Are
Yeah,
you there, Jack?
he had to run. Yeah,
He had to
Jack
go.
had to run. He has an emergency. He had an emergency. I think someone had the symptoms of COVID-19, so he had to run just a few minutes ago. Yeah,
Ah,
thanks.
okay, not to worry. So, Alex, again, we just mentioned briefly the role of your work in a fistula, around fistula. If I can now bring you in, I know Dr. Abayomi just mentioned, you know, diverting resources away from key areas such as diabetes, women's health. So when you're ready, could you come on and present on what the importance is in providing healthcare to women facing COVID or affected by COVID?
Yeah, hello everyone, good afternoon or good evening, depending where you are. So thank you for letting me be part of this discussion today. Yeah, I'm really honoured to be part of this group, and it's great to have a discussion about COVID across Africa. It's been really interesting to hear experts from all different sectors. So I want to talk about how we can improve health service delivery across Africa and make sure that the huge amounts of funding that we've seen for the COVID response goes to where it's needed. So goes to caring for COVID patients and looking after those frontline workers, but also to not forget about the essential healthcare services, including those for girls and women. So just to introduce myself, I'm the Programmes Manager at the Aberdeen Women's Centre in Freetown in Sierra Leone. So the Aberdeen Women's Centre, or AWC as it's known, is a hospital in the capital of Sierra Leone, and it provides free healthcare services to women and children, including maternity, obstetric fistula treatment, family planning, a children's outpatients clinic, teenager mother empowerment, and SGBV care. So AWC is based around trauma-informed care. So we not only provide health services, but we also try and do some economic empowerment and provide safe spaces for women and girls to be there. So we're run by a very small Scottish charity, but that's a little overview of what we do. So I want to talk about women and girls during COVID. And just in the past couple of weeks, we've seen on the media a huge increase in sexual and gender-based violence, including a 25% increase in domestic violence in the UK, which is where I'm from. In Sierra Leone, during Ebola, there was a 19% increase in survivors accessing services for SGBV support, and there was a 65% increase in teenage pregnancy as schools were closed. Now the same is happening at the minute. Schools are closed in Sierra Leone. And so as healthcare practitioners, as policymakers, as activists, as economists, as judges, we need to be prepared for this surge in the need for healthcare services by women and children. So in Sierra Leone, at the minute, just this week, the Minister of Basic and Senior Secondary Education, Dr. Sengi, has urged families and community leaders during the lockdown and the curfew that's currently in place to ensure that no teenagers get pregnant. He wants people to protect girls so that when schools reopen again, everyone can go back to school and learn. Also this week, the Ministry of Gender and Children's Affairs has announced a free hotline for SGBV victims to access, where they can be signposted to where they can get their free medical and psychosocial support. So these are great initiatives by the government of Sierra Leone, and it's really good to see women and girls' well-being at the heart of the government's response during this pandemic. Obviously, it's easy to, and it's right to focus on the COVID response, but yeah, my presentation is just to try and highlight that we need to keep women and girls in mind. So organisations, including the Aberdeen Women's Centre, who offer these essential healthcare services, including family planning, fistula treatment, SGBV care, have not been given any extra funding. So instead, we're seeing that funding for these essential services being diverted towards the COVID response and prevention. Now, this diversion of funds is not just happening in Sierra Leone or in Africa, it's happening all over the world. So in the UK, the NHS has cancelled all smear tests, it's closed drop-in services for sexual health clinics. So when funding is diverted away from these services, the services struggle to stay afloat. They have to close, and the women and girls with the health needs can't access them. So they stay home, they get ill, they get pregnant, they get abused. So as a collective group, we need to ensure that investments and planning focuses on these women and girls. So we need to encourage women and girls to go to health facilities to access essential services. So if you're pregnant, if you are due to have your baby, you still go to that hospital to deliver. You don't stay at home. We need to make sure that when they arrive at hospitals, so as the doctor was saying, when they arrive, that the clinics are there, that the services are running, and that the funding to keep the staff there, to keep the drugs in the cupboard, has not been diverted away. And as the doctor said, and a few other people, telemedicine and the use of technology is really important to reach the women who are most at need, and making sure that when we have telemedicine, that it's skilled health workers that are on the end of the line. So not, people that have been trained. So for example, Aberdeen Women's Centre, we currently use telemedicine anyway, as part of our normal day-to-day running. So for example, with our obstetric fistula patients, we have a hotline, and if someone thinks that they have a fistula, they ring us, they speak to our head nurse, and we do a triage system, and we go for a questionnaire. We also use telemedicine to remind our teenage mums to come to ANC appointments, and we use it for following up with patients. So the Aberdeen Women's Centre works all over Sierra Leone, so we can't just sort of pop round to someone's house and ask them a question. So we have to use telemedicine anyway, and I think it's a great idea that we should use it more during this time. Now, I've been reading a lot of articles and things and trying to keep up with all the news, and the Lancet published a really great article last week, which I just want to read a quote from. It says, "Past humanitarian crises have shown that there is a reduced access to services, including family planning, abortion, antenatal, HIV, gender-based violence, and mental health care. Additional resources must be directed to and not diverted from the sexual and reproductive health workforce so that effective evidence-based approaches are deployed." So we really must keep in mind women and girls during COVID, and we should aim to keep these essential clinical services open for them. Because my fear is that if we don't, there will be a huge sort of gendered scar that's left by this pandemic in months and years to come. So that's me. But if anyone has any questions or anything, feel free to ask, and I'll share my email as well. So thank you.
I was going to ask a question, but those are very incredible points that you've raised, one that we all, I think, have to have in mind when we are preparing to respond to COVID. Too often women and girls are left behind. And I think it's important that these marginalized, as Jake rightly presented last week, are not left behind, because too often women will be shy to access services if they are at all facing with those challenges. But I hope you can stay because of our time. I'm going to call on a policy expert, Mr. Mohamed Macmond, Michael Calon, who has been the first participant to log in. And we apologize for extending our time with this discussion, conference, summit, whatever we want to call it. But these are important issues and one that is very close to us. And I see Lino is nodding his head. He's also been from the start. Thank you so much. And Grace, thank you also very much. But if we can have Mohammed, because some of our speakers have sort of gone off because we've extended our program. But thank you so much, Alex. And please don't go away. I hope you can share some of the best practice that you've mentioned